One of the biggest legislative priorities was this realization of mental health reform. Why are you so passionate about the issue?
Well, I'm a psychologist by training, 40 years in practice, and the only practicing mental health professional in the elected federal government. And what happened, particularly after the tragic shootings at Sandy Hook Elementary School, followed by a wave of other massacres, I realized that somebody had to do something about it, and so looking in the mirror, realizing, if not me, who, and if not now, when. I led a series of hearings in Washington, D.C., and actually in multiple states around the country, and the answers kept coming back the same. Our mental health system in this country is not a system. It's disastrous. It's not even a patchwork quilt, because that's assuming it's sewn together. It's underfunded. It's also has several barriers that the federal government sets up to prevent people from getting care, preventing families from being involved, preventing the number of hospital beds that we need. And so it's no wonder that over the last decade, we've seen an increase dramatically in the number of suicides, the number of homicides, the number of victim deaths, the number of people who are dying from drug overdoses. In 2015, if you add suicides and drug overdose and homeless deaths, etc., we are approaching about 85,000 deaths just last year, mental health related. That, by the way, is more than the number of United States combat deaths during the entire Vietnam War and Korean War combined. It's awful. So I've written a bill to change that, to say that we have to restructure the 112 federal agencies that deal with mental illness scattered across 8 departments. We have to put accountability in there for grant programs instead of the sloppiness that's in there now, and funding silly things from collages and making masks and getting in touch with their inner animal and paying for paintings in federal buildings. We have to make sure that it's run by someone that's their field. Just as the Center for Disease Control is run by a physician, and the National Institute of Health is run by someone with an MD after the name, we want to make sure that the head of this is going to be an assistant secretary of mental health and substance abuse, who's going to be a psychiatrist, psychologist. We want to make sure we eliminate the Medicaid rule which says you can't have more than 16 psychiatric hospital beds. Eliminate the Medicaid rule which says you can't see 2 doctors in the same day. And make a tiny but extremely important change to the HIPAA privacy laws, which would allow a loving and caring family member to have just enough information to help, not the therapy notes, but even such things as knowing when the next appointment is so they can get the person there. For the cases when someone has serious mental illness, not all cases, but the ones where the person simply can't take care of themselves, but they don't fit the legal definition of what's called incapacitated, but they're falling apart. We have become a country that has become accustomed to walking over the homeless, from ignoring the problem, but suddenly being in shock when a tragedy occurs. And what we need is treatment before tragedy, not continuing to do this and becoming numb to the results, because we have this perverted idea that the most compassionate thing is to do nothing, and I don't agree. So this legislation, now with 178 co-sponsors, 48 Democrats, the rest Republicans, strongly bipartisan, has got to pass. It will save lives. It will ultimately save money out of the nearly $440 billion we spend every year in this country in mental health related problems, and it'll save families, and that's what we have to do.
Perfect. You've really made a good point about the human aspects of the story. What about the business case for this type of reform? You touched on it a little bit when you mentioned savings. Are there other points you'd like to make?
Mental health issues impact 1 in 5 people in any given year. 1 in 5 people have some diagnosable level of mental illness, from the very mild and transient, struggling at work, struggling at home, a divorce, a death in the family, dealing with an illness, to the very, very severe. And the very severe cases of schizophrenia, bipolar, severe depression, schizoaffective disorder, affect about 10 million Americans. Across those spectrums, it affects people in the workplace. If you've got 100 employees, you've got 20 who are personally dealing with the problem, and you've probably got 40 who've got a family member who's dealing with the problem. That takes their mind off of work. It's what's called presenteeism. They're there, but they're not really there. They're straining. They're worried. It's a struggle for them. And employers would do well to pay attention to those aspects, to make sure that people are getting assistance if they need it, getting help if they need it. But the trouble is, if we don't have enough psychiatrists, psychologists, or treatment centers, all the compassion in the world will not do anything if we can't get them the care. We have to change that, and employers would do well, even if all they're looking at is the bottom line, would do well to make sure those problems are addressed and understand that mental illness is a brain disease, like Alzheimer's, and Parkinson's and dementia are also brain diseases that we need to be addressing. It's going to affect a lot of people. Ignoring it doesn't work, and it actually can lead to more toxic things in the workplace and more problems with productivity.
Good answer, thank you. And then finally, I guess the status of the reform bill in Congress.
The bill is H.R. 2646. It's called the Helping Families in Mental Health Crisis Act. It has 178 bipartisan co-sponsors. It is passed through the House Energy and Commerce Health Subcommittee. It is now headed for the full committee for a markup. We're looking for bipartisan support there and bring it to the floor, hopefully within February or March. Then on to the Senate. There's a Senate parallel, not completely the same, but a parallel one brought forth by Senator Cassidy of Louisiana and Senator Chris Murphy of Connecticut. They had a hearing on that recently in a committee in the Senate. People are aware we've got to do this. The President has talked about putting money into this, but Congress has to make sure we know an investment here, a small investment, has a big carryover. When you're looking at $440 billion per year in the mental health area, and another $50 to $100 billion in the criminal justice area, that's a lot of money to spending on something. So I believe if we can even come up with something like $1 billion to spend on some of these programs to create incentives for states to do a better job, it would make a big difference. But more than anything, it makes a big difference for some lives that we save.